This patient has a dislocated CTR-IOL-Capsular Bag Complex. I'm going to show you how to remove the CTR without losing the IOL posteriorly in the process. So I'm holding the complex with a micrograsper. I'm going to add a lot of dispersive viscoelastic, and now I'm going to prolapse the complex above the iris here so that the iris can capture it. If you do this properly, you can let go of both of your instruments and the complex will not fall back, and as you'll see here, so the complex is stable. I'm going to remove one of the iris hooks. This will actually prevent the complex from migrating posteriorly as well. And here I'm going to cut the lens about 90% across, and now I'm going to pull on the CTR. Now the CTR will actually hold the IOL. Now as you get to the very end of the CTR, this is when you need to do this bimanual technique where one hand holds the IOL and the other hand lets go of the CTR, as you can see here. And now I'm going to cartwheel the IOL out. It's cut 90% across, and then I'm going to remove the capsular bag as well. So let's watch this again. Dispersive viscoelastic, because I'm going to prolapse the entire complex above the iris, and the iris will essentially hug the complex. And by removing one of the iris hooks, you basically reduce the pupillary size and basically provide more support in preventing the complex from moving posteriorly, as you can see here, removing one of the iris hooks. And this will also allow me to create my main wound and then cut the lens. And as you cut, you're creating a plane between the CTR and the IOL. You can pull on the CTR, and as you get to the last quarter of the CTR, this is the part where you want to grab onto the IOL before, right there, and then pull on the CTR. And if you do this, the IOL won't fall back because you're holding onto it. And then basically cartwheel the IOL, followed by the capsular bag, and then you can proceed with your method of preference for secondary IOL fixation. I hope you found this video to be useful, and thanks for watching.